So now let us start on the neurosurgery basics. Neurosurgery elective, because emergency parts of neurosurgery is more important than electives. So emergency neurosurgery including head injury, SDH, EDH, SAH, diffuse arachnoid, diffuse axonal injury, all those things, Glasgow coma scale, everything we have discussed in trauma, that is more important than this neurosurgery. This is very, very less questions are being asked. There are only two important topics. One is berry aneurysm and another is tumors. So berry aneurysm in the circle of Willis. So anatomy related question, circle of Willis, berry aneurysm is most commonly seen which vessel? You can see this is a berry aneurysm in a circle of Willis. In circle of Willis, if you see an aneurysm, it is called as berry aneurysm. Most commonly involved vessel is anterior communicating artery. Don't forget, it is anterior communicating artery. Circle of Willis, anterior communicating artery is the most important artery. So this artery is going to get 40% of the aneurysms. That is the first. So don't forget anterior communicating artery. Second commonly seen in middle cerebral artery. That is the second, followed by middle cerebral artery. Can you tell me which is the least common site? That is the MCQ again asked in NEET PG. So most common in anterior communicating, second middle cerebral, least common in basilar artery. That is the least common site. So most common site is anterior communicating, middle cerebral artery and basilar. So don't worry, I will share the PDF, whichever missing you can write it later. Just attend, these are all basic questions of neurosurgery. So anterior communicating artery and middle cerebral artery are the two important arteries, most common, least common in basilar artery. So tell me what is a common presentation. Before that, tell me whom it is common. It is most common in females. It's more common in smokers. It is most common in hypertension patients. People who are having hypertension, and it is associated with Ehlers-Danlos syndrome and Marfan syndrome. Ehlers-Danlos syndrome and Marfan syndrome patients may develop berry aneurysms. Polycystic kidney disease, they also can develop berry aneurysm. So berry aneurysms, the major problem is the common presentation is, see, even some of us might be having a berry aneurysm without knowing we are having berry aneurysm. It will present to hospital only when it gets rupture. When it ruptures, it produces subarachnoid hemorrhage. We have discussed about subarachnoid hemorrhage in trauma. So maybe one of that reason I would have not given in some of your materials. Subarachnoid hemorrhage, it ruptures and causes thunderclap headache. The patient will tell, sir, I'm having a thunderclap headache. They come to hospital with a thunderclap headache is a common presentation of this berry aneurysm. So there is a clinical grading system which is commonly used to know the grade of the subarachnoid hemorrhage. It is Hunt and Hees. Hunt and Hees grading is the system used for grading the subarachnoid hemorrhage by a clinical method. There is a CT grading also. CT grading is called as Fisher grading. Clinical grading is called as Hunt and Hees grading. Don't forget these two names. So CT scan grading is Fisher, Hunt and Hees is clinical grading, and the investigation of choice is CECT of the brain. What finding will you see in a CT brain? Yes, most of you know the answer. What is the finding of subarachnoid hemorrhage in a brain? You have a hyperdense lesion in the subarachnoid space looking like a, yes, stellate star-shaped hemorrhage. Very good. Star-shaped hemorrhage will be seen on CT scan. Don't forget this point. Star-shaped hemorrhage is seen on CT scan. That's a simple MCQ. This is an image-based question also. I have covered this MCQ in trauma chapter. If you go back and see, you'll see that star-shaped hemorrhage will be seen. So the major issue is these patients, 1/3 of them die on the way to hospital. Remaining 1/3, remaining people, most of them may die due to rebleeding also. So the major problem is subarachnoid hemorrhage is going to kill the patient, not the berry aneurysm as such. Berry aneurysm bleeding will kill the patient by rupture only, bleeding only. So the Tierson syndrome is a condition of subarachnoid hemorrhage plus vitreous hemorrhage. So Tierson syndrome is a question from Bailey and Love, subarachnoid hemorrhage with vitreous hemorrhage. So is there any other method of diagnosing subarachnoid hemorrhage? Means if I do lumbar puncture, what will I see? Usually it is not done. Please don't forget. Subarachnoid hemorrhage is diagnosed on CT scan. In case of doubtful cases or delayed presentation, in a case of delayed presentation or those cases you'll get. So you can do CT scan as well. CT scan is mainly done to see the aneurysm of the brain. You can see when you tell CECT, contrast enhanced CT, it always includes non-contrast also. This star-shaped hemorrhage is a finding of non-contrast CT. But CT we will do to look for aneurysms. The present seen aneurysms also can be detected on CT scan. Therefore, we do both non-contrast as well as contrast. Both are done for berry aneurysms. So non-contrast CT shows this star-shaped hemorrhage. So lumbar puncture shows a xanthochromic color of CSF. So xanthochromic CSF is a finding in lumbar puncture. Don't forget, that is another MCQ. So the first important thing in a berry aneurysm bleeding, please don't forget the patient is not going to die in a head injury due to hemorrhagic shock. He is dying because of neurological deficit. The bleeding which is happening is going to compress some important nerves and cause the problem, or going to stop the blood flow to the neurons and going to kill the patient. Therefore, we should immediately start the patients on triple H therapy. Subarachnoid hemorrhage patients, to prevent delayed neurological deficit, start them on triple H therapy. Give them high fluids. Give more fluids. Induce hemodilution. And you should induce hypertension. See, by doing this, the hemorrhage which is happening inside the brain, that hemorrhage will not obstruct the neurons. We will dilute it and we make it come out, so that will not go and cause neurological deficit. So this is called as triple H therapy. Induce hypervolemia, induce hemodilution, and induce hypertension. So don't think that there is an hypertension that is going to cause more bleeding. Usually the amount of bleeding which is going to happen is going to happen. We will do triple H therapy and shift the patient immediately to radio center, where there is clipping and coiling can be done by means of angio. No need of even surgery nowadays. You can even do it by angio method. Cerebral angiogram. Cerebral angiogram is done, and you can do clipping and coiling of the bleeding vessels is done for berry aneurysm. So please don't forget, berry aneurysm is a favorite topic. Especially, they will always ask what is the common site of berry aneurysm and what is the common presentation of berry aneurysm. Those are basic questions. And brain tumors, please never forget, brain tumors are the most common solid tumors in children. Brain tumors are the most common solid tumors in children. So most common solid tumors in children is brain tumors. Most common brain tumor is usually metastasis from the lungs. It is mostly from 40% from the lungs. Breast is 15%. Third is melanoma. And renal cell cancer. Most common brain tumor in females is metastasis from breast. So overall, it is lungs. So investigation of choice for brain mets is usually a contrast enhanced CT brain. So CECT brain is the investigation of choice for brain mets. So drug of choice, when a patient with a brain tumor has increased intracranial pressure, the drug of choice is steroids. See, I told you steroids are contraindicated in trauma, or contraindicated in trauma-induced increased intracranial pressure. If it is a trauma-induced intracranial pressure, we don't give steroids. But at the same time, in a brain tumor, steroids are the best to reduce the intracranial pressure. So CT brain is done. So don't forget, we can also do MRI. We can also do MRI of the brain is also used in selected cases for selected type of tumors. MRI is also beneficial. But usually CT is available everywhere. So most of the patients are diagnosed with CT. So most common primary brain tumor in adults is GBM. Don't forget this. What is GBM? Glioblastoma multiforme. Glioblastoma multiforme is the most common primary tumor of adults. Children, it is pilocytic astrocytoma. Pilocytic astrocytoma. See, what are these two? These both are astrocytomas only. Astrocytes are one of the important cells in the brain. Astrocytes are important cells. Oligodendrocytes, ependymal cells. These are the three important glial cells. So, glial cells are neuron cells which will produce tumors. Astrocyte produces astrocytomas which are of 4 grades. Grade 1 is called as pilocytic. It is good prognosis. Whereas grade 4 is called as GBM, worst prognosis. The other tumors are oligodendroglioma, ependymoma. All these are the various other primary brain tumors. And butterfly tumor is also known as glioblastoma multiforme because you can see from this picture in a MRI, it is extending from one side to opposite side like a butterfly. So usually a tumor will be confined to one cerebral hemisphere. So it extends to opposite lobe. Extends to opposite lobe of brain. Therefore, it is called as butterfly tumor. Don't forget, it is therefore called as butterfly tumor due to its extension to opposite lobe of brain. It's a very bad prognosis. They have poor survival. This is the commonest tumor of brain. So, histopathologically, some MCQs from pathology are fried egg appearance and chicken wire cells are seen in where? Where will you get fried egg appearance and chicken wire cells? It is seen in, yes, it's a repeat pathology question, not surgery question. They are seen in image-based questions from pathology. Please go through image-based. Yes, oligodendroglioma. Very good, Sharon. Very good. This is a oligodendrogliomas will have this fried egg appearance or chicken wire cells are seen in these patients. Samoma bodies are seen in meningiomas. So it's a concentric calcification you get in many tumors like papillary cancer of the thyroid. Also, you get this. This is a meningiomas can have samoma bodies. So medulloblastoma, please understand it is a neuroendocrine tumor of the brain. It's a neuroendocrine tumor of brain. It is associated with Turcot syndrome. Can you tell me what is Turcot syndrome? It is associated with GIT. Turcot syndrome is FAP plus brain tumors is called as Turcot syndrome. Very good, Prasanna. Familial adenomatous polyposis can develop Gardner syndrome and Turcot syndrome. Turcot syndrome is FAP. It is commonly seen in children and it is seen in cerebellum. This is a very interesting point. It is seen in cerebellum. Okay, it is seen arising from the cerebellum. It is having a special feature called as drop mets. Drop mets are seen in these patients. Medulloblastomas have a staging system. Can you tell me what is the staging system used? Staging system used is Chang staging system. There is a staging system used in medulloblastomas called as Chang staging system, and treatment is you have to do it has drop metastasis into spinal cord. It causes drop metastasis into spinal cord. Therefore, you have to do irradiation of craniospinal irradiation. Is one of the important treatment for medulloblastoma. See, be thorough with the medulloblastoma. It's one of the favorite topics. So, though glioblastoma is common, medulloblastoma very, very rare tumor, but just remember the basic points. So, medulloblastoma is associated with Turcot syndrome. It is commonly located in the cerebellum. It can drop metastasis into the spinal cord. So, spinal metastasis can happen. Therefore, you should irradiate both the cranium and the spinal cord. Okay. So, meningioma is the second most common tumor inside the skull. Second most common tumor after GBM. It is associated with the neurofibroma 1 and 2, and it is also called as most common extraaxial tumor because it is not growing into the brain substance. It arises from the meninges, durameter. So it arises from the durameter and it has best prognosis. Calcifications are seen and there is a recurrence predicted by a grading system called as Simpson grading system. There is a grading system called as Simpson grading system because that it is a curative lesion. Meningioma is very good prognosis. It is curative. Prognosis depends on resection. How well you resect, the prognosis depends. If you remove it without any residual tumor, you are going to have a good prognosis. If there is a residual tumor, they will go for recurrence. So that resection is given by a grading system called as Simpson grading system. So don't forget Simpson grading system. Okay. So craniopharyngioma is another important tumor which is arising in children from the pituitary fossa. So please remember, pituitary fossa tumor. Pituitary fossa tumor, or the patients will have suprasellar, from the suprasellar area, and it is characterized by, what is the finding in craniopharyngioma? Can you tell me? What is the finding of craniopharyngioma? This is an image-based question. So can you see the suprasellar calcification? So these patients are characterized by diabetes insipidus. Yes, it's a calcification, diabetes insipidus. These patients will come to you, babies will come to you with the diabetes insipidus presentation. So don't forget, the most common pituitary fossa tumor in children is craniopharyngioma. What is the adult? Adults, which will produce milk, prolactinomas. Prolactinomas are the common cause of suprasellar calcification in adults, and children it is craniopharyngiomas. Yes, there will be visual anomalies. That's absolutely correct. Diabetes insipidus plus visual anomalies. Pituitary tumors, you will be reading bitemporal hemianopia, all those things from ophthalmology. Please remember the visual anomalies which can happen because of pituitary tumors. Not only with the craniopharyngioma, any pituitary tumor will have visual anomalies. The next interesting topic in neurosurgery is from neural tube defects. The fusion of the neural tube. See, when people are having folic acid deficiency during first trimester, folic acid deficiency is one of the important cause, especially in first trimester, or people who are on anti-epileptic drugs. Parents who are on anti-epileptic drugs, they can develop the failure of fusion of the neural tubes. Failure of fusion of neural tubes. So because of the failure of the fusion of the neural tubes, they will develop some anomalies called as spina bifida occulta, spina bifida aperta. So there are two things. Spina bifida occulta is, you can see from this picture, the vertebra is only having a small gap. The vertebra is having a small gap, but usually the spine is fused. That is no herniation of the meninges. Therefore, you will have only spina bifida occulta will have only tuft of hair. Tuft of hair will be present and no clinical symptoms. You can even see many adults having this feature. This is because of spina bifida occulta. They are lucky, nothing happened to them. They will only have a lot of tail hair. In the lumbar region, they'll have a bunch of hair. That is the only finding in spina bifida occulta. Spina bifida aperta, it is characterized by meningocele and meningomyelocele. So if only the meninges, durameter, arachnoid is only coming like this, it is called as meningocele. If along with the meninges, the spinal cord is also coming out, so dura arachnoid along with the spinal cord is called as meningomyelocele. So meningocele, meningomyelocele. So meningocele alone is coming, sac of meninges coming will contain CSF. Contain CSF inside the swelling. Meningomyelocele will contain CSF and the nerves. So meningomyelocele is coming, the spinal cord is coming out, means be careful. It can cause hydrocephalus. It can not only affect the spine here, it can affect the brain also. They have hydrocephalus and cerebellar herniation called as Chiari 2 malformation. Very dangerous problem. Meningomyelocele will have Chiari 2 malformation, which is nothing but cerebellum herniation. Cerebellum herniates via the foramen magnum. So it's an emergency, especially if it's a meningocele or meningomyelocele. We have to repair within 24 to 48 hours. If you delay, the meninges can open up and you can get a CNS infection. So do surgery as early as possible, especially for spina bifida aperta. Spina bifida aperta needs surgery. Spina bifida occulta, no surgery needed. So these are the image-based questions. This is a picture showing you occulta. This is a picture showing you aperta. Aperta will have transillumination positive. So transillumination is excellently positive in these cases. And this is a picture showing you neurological deficit seen in only in meningomyelocele. Don't forget meningomyelocele. Usually only meningocele will have no neurological deficit. Neurological deficit is seen in meningomyelocele. You can see the crisscross pattern. The patients can have paraplegia. Maybe present like this. Crisscross limb you are seeing in this. So don't forget this point. Very interesting image-based question. And this is a picture showing you the cerebellum. Can you see? This is a cerebellum which is herniating into the foramen magnum. What is this deformity? This is Chiari malformation 2. Chiari malformation. If Chiari malformation 1 is isolated cerebellar herniation. Cerebellar herniation isolated is called as 1. 2 is cerebellum plus meningomyelocele herniation. Meningomyelocele is present along with hydrocephalus is called as 2. So there are 2 types of Chiari malformation. Only cerebellum herniating is 1. Cerebellum herniation with the hydrocephalus is 2. And there is another interesting image from Bailey and Love. The posterior fossa or the cystic expansion of the 4th ventricle like this is called as Dandy-Walker malformation. So Dandy-Walker malformation is a posterior cranial fossa. That is a empty space. Cystic expansion of the empty fourth ventricle is called as Dandy-Walker. So cerebellar tonsil herniation means more than 5 centimeter is into the foramen magnum is called as Chiari malformation. Chiari malformation is called as more than 5 centimeter herniation. Is called as Chiari malformation. See, the number of questions we are discussing from these sections are very few in the last 4-5 years. So only 1 or 2 questions like most common brain tumor in children, pilocytic adults, glioblastoma multiforme, this fried egg appearance, chicken wire appearance in oligodendroglioma. Very few questions have come in the past few years. That is why in the app, if you see in our regular videos, I would have discussed these 3 hours of neurosurgery, 2.5 to 3 hours. But practically none of the questions came. I don't want to waste your time, especially near the exam. Just whatever I'm telling you are basics. You remember these topics alone. So this is a picture showing you a classical meningioma. Why I'm saying meningioma? Because it has calcifications. So calcification is present in meningioma. That's a classical feature. It is the most common extraaxial tumor. So don't forget, most common extraaxial tumor is meningioma. Calcification is present. It is having good prognosis. When you do surgery, they will be absolutely all right. So what is this disease? It's a very interesting disease where the internal carotid artery occluded. So the internal carotid artery is a very important artery to supply the brain. When that artery gets occluded, multiple collaterals form in the neck called as moya-moya disease. So when internal carotid artery is occluded, multiple collaterals go towards the brain called as moya-moya disease, and it is also called as what appearance? Puff of smoke appearance. It's called as puff of smoke appearance. It is called as puff of smoke appearance or internal carotid artery occlusion. So don't forget, this is moya-moya disease. It's having a puff of smoke appearance. So this is an autoimmune disease. Multiple collaterals are formed from the external carotid artery because internal carotid artery is occluded. Treatment is superficial temporal artery to middle cerebral artery. You should do a bypass surgery. Don't forget, we have to do a bypass surgery. This is a medicine question. A patient comes to you with a clinical feature of hemiplegia. So hemiplegia of opposite side. Patient has an hemiplegia of opposite side and typical LMN palsy of the facial nerve. So this is a typical case of intracerebral hemorrhage. Intracerebral hemorrhage. What is the most common site of hemorrhage? It is in the putamen. This is a medicine question. You will be reading about this intracerebral hemorrhage in medicine. So putamen is a common site of intracerebral hemorrhage. So most common etiology is hypertension. Being hypertension is one of the important causes of such intracerebral hemorrhage. So intracerebral hemorrhage bleeding into the brain can cause contralateral hemiplegia and element facial palsy. So go through this hemiplegia in your medicine contents. So from elective neurosurgery, the questions are very less. Only the surgical related question is tumors of brain. So only tumors of brain is surgical question. Otherwise, you will be discussing all these questions again in medicine also. So these neural defects like spina bifida occulta, apercha, all these things you'll be reading. Even berry aneurysm you'll be reading again in medicine. So don't forget the basic things. Simpson grading system is a resection grading of meningioma. Simpson grading is a resection grading of meningioma. Fisher grading is a CT scan grading of subarachnoid hemorrhage. Hunt and Heath is a clinical grading of subarachnoid hemorrhage. So Hunt and Heath, Fisher, Simpson, all are asked in the exam. Don't forget. So Jank staging is used in medulloblastoma, which is no more used. Once upon a time, they used all this. But presently, we are not using those stagings. Just know these points from neurosurgery. So neurosurgery related basic questions, please don't forget these questions.